So following my residency training, my first job was at a community clinic serving very low-income families. Very quickly, I had an experience with two patients that made me realize that good medical care alone was not enough to keep my patients healthy. One was a little boy with Down syndrome and a very serious heart defect as well. I was able to get him the specialty care that he needed just a couple miles away at Stanford Children's Hospital with a pediatric cardiologist. But his family struggled in getting to the appointments I made for him. Their car often broke down, and taking public transportation was a mess. It required multiple buses that didn't show up on time or didn't come at all. I had another patient who'd been born 3 months prematurely, and he had chronic lung disease as a result. He suffered from bouts of recurrent pneumonia that I struggled to treat until one day his mother mentioned that they had several broken windows in their apartment that their landlord had not gotten around to fixing. In both cases, my ability to provide good medical care, prescriptions, specialty referrals wasn't enough. And in fact, for these families, the problem was not the cost of medical care or insurance. I'd done things to make sure that those were not the main barriers. And it certainly wasn't a lack of desire on the part of the parents to help out their child. Instead, the problems were transportation and poor quality housing. Medical school just had not taught me how to deal with these issues. So as a physician, I found myself working late hours, not reading up on the complex medical issues they had, which were really complex, but rather searching for ways to obtain free taxi vouchers for the one little boy and writing letters to the landlord for the other. Very firmly worded letters, I'll add. That was my aha moment, the realization that I couldn't do it alone, that I had to work with colleagues from outside the medical system in order to keep my patients healthy. I really needed to work with colleagues who were able to change for the better the places in which my patients and their families lived.